Hi everyone, as Di said, I'm Nicky Timmis. I'm the Public and Patient Involvement and Engagement Manager at Health Innovation Manchester, and I'm part of a small, dedicated, user-centred design team. And we're a relatively new team really, but we basically bring together business analysts and people like myself that have got some experience of engaging with local people. And we work together to support the development of services, health and care services that meet the needs of all end users. So whether that's clinicians, the system, or importantly, patients themselves. And this afternoon, you've heard all about the fabulous work of our voluntary sector partners that supported this work around lipids. But we thought it was important to provide you with a very brief overview of some of the learning that we gained through a community engagement programme that was undertaken independently of these voluntary sector partners and the work on the lipids programme. And the purpose of this community engagement was to raise awareness around the importance of early detection and screening amongst groups where we know the high risk of disease, but also where there's low uptake of NHS screening when it's offered. We also wanted to recruit people into health research, and there was a project on the programme called the Early Detection of Heart Failure Study. That very much had a focus on recruiting people from disadvantaged and different ethnic groups. So we wanted to support recruitment with that. But we also wanted to use this engagement as an opportunity really to start to really explore what the barriers and the enablers to early detection and screening are from the point of view of different communities. So the map on this slide on the screen, that basically shows you some of the communities that we included as part of this work. So there's the South Asian community, the Black African and Caribbean community, people who are homeless, people who are at risk of homelessness, white working class men, the Jewish community, the Eastern European community, and the Chinese community. But how did we decide which communities to include? Well, secondary sources were important, but so was data. I think Nana touched on that earlier about how data informed what they did. Well, it's the same with us. But there was a company called GraphNet, and they had a case finding tool, and that helped us identify which communities were at greatest risk of diseases that are relevant to this programme, but also where they lived in Greater Manchester. But we didn't just rely on data alone. We were also, our work was also informed by some of those known unknowns. So what we know, we don't know. And that includes, around people's different communities' experiences around access to healthcare. As you've heard this afternoon, to do this work, we also had to work really closely with voluntary sector partners, but also community and faith leaders. They've got trusted relationships, and that meant that they were really well placed to support us with recruitment, identifying accessible venues, arranging culturally appropriate food, managing reimbursements, and providing translation and interpretation support wherever that was needed. They know communities best, so they were also able to give us advice on guidance around what approaches might work with different communities. And throughout this programme of community engagement activity, we reimburse partners, whether it be voluntary sector providers or public members for their time, in recognition of the vital knowledge and expertise and contribution that they made to our work. And this collaboration led to the delivery of 30 co-created events and activities involving more than 440 people. That's 440 people in addition to the 459, was it, that was engaged on the lipids programme. And this is, all of those people were from deprived backgrounds. They were ethnically diverse, but it also included people with multiple risk factors for diseases that were relevant to the programme. And by working together, we co-created more than 32 outputs, which included posters, patient stories, short films and blogs. So we haven't got time to show you all of those today, but I've brought one along to share, which is about a community member that attended one of the lipids sessions.
My name is Valerie Leveridge. I live in Sale. I was told about it by a friend who said, you know, you need to go along and just get yourself checked just to make sure that everything's okay. It was really good because when you went along, the calm people are a mixture of nurses and other professionals, so they take really good care of you. It's not painful, so people who have fears of needles don't need to worry because it's all done through your pinpricks, and they have really good equipment as well that does the results within minutes, 10 minutes. You've got your results on your cholesterol levels and your blood pressure. That's instant, obviously, and whether you're diabetic or not. That's fairly quick as well, which is really important in our community because I'm Caribbean in origin. I was born here, my parents are from Jamaica. It's very prevalent, very, very prevalent, and lots of people don't know that they have it because they don't know what the symptoms are, so they don't necessarily go to the doctors to check. So I found that this was really, really good. And for a lot of people, it would give them the segue to go and talk to their doctor because the results are sent on to actually get treated, which is really, really good. So it's getting to people who wouldn't normally go to their doctors because they just feel they're not heard. I think it's perfect for a lot of people because, as I say, there are many people who don't trust the health system. They don't trust that doctors have their best interest at heart. And there are a lot of people that that say I'm only coming because it's here, because they know can't do screenings sometimes at churches on a Sunday, so you're accessing people when they wouldn't normally expect to be accessed, and it's like they're already there, so why not? You know, they're not having to take time out of work and go or that kind of thing. So it's really important that when we have the opportunity to get it literally where we are at our churches or at our community centres, anywhere like that we do engage, because I know for a fact that some of the screenings that have been done have saved lives. People could be on the point of becoming really ill, and it's alerted them to the fact that their blood sugar is massively high, or that kind of thing. And in a way, I wish it had been around years ago, because my husband has gone through lots of different, has got lots of health issues, and if those had been brought up earlier on, there might have been something. He's not dead or anything, but there might have been something that could help with, could have helped with that, and just earlier recognition of those problems would have been good. So yeah, I think it's a really useful thing, and I just urge people really to go. It's not painful, it doesn't take long. And the staff are really nice. They engage with you. They keep you relaxed and calm if you get nervous in that situation. They just have conversations, and it's just being done in the background. And I think it's really worthwhile. It really is.
Into our offices because our funders Innovate UK wanted to create a case study, and we were chatting, and she was explaining to me that when you go to the doctors you only get a few minutes, as somebody said before, and how she didn't felt rushed, she had plenty of time. But the other thing she said, which really struck a chord with me, is that she said when she was able to get dietary advice that was culturally appropriate, so not only were they able to tell her what food she's still okay to eat, but also how to cook it, and that probably wouldn't have happened if she was seen by a healthcare professional that didn't understand the culture. So what else did we learn then? Well, our findings just absolutely reflect what you've heard from voluntary sector partners today, really, and that is that cultural differences, language barriers, digital exclusion, practical barriers, mistrust of healthcare, misinformation, worry and fear all play a part. and that health literacy and a lack of understanding around the importance of screening and early detection is an issue across communities. But health literacy doesn't just exist in isolation. It intersects with ethnicity, culture, language barriers, religion, spiritual beliefs, financial pressures, including food and fuel poverty, logistical challenges, mobility issues and the existence of long-term conditions, digital access and the difficulties of navigating a complex NHS, especially if your first language isn't English, sexuality and gender identity, perception, mistrust of healthcare and exposure to misinformation, homelessness, insecurity around housing and employment. And all these factors really affect people's ability to understand and act on invitations when they receive them. It might also help explain why some patient groups might delay screening if they're asymptomatic or wait until their condition is really severe. In terms of the enablers, again, it very much reflects what you've heard today. Local people told us that early detection and screening would be far more accessible if information was culturally informed and easy to understand. If appointments were flexible enough to meet people's accessibility needs and fit around their lives. They also stressed the value of health awareness and interventions being led and delivered where possible by people that are known and trusted in communities. But if I had to narrow it down to one takeaway, it would be the importance of bringing services closer to the communities they serve and supported and delivered by voluntary sector partners wherever possible. To learn more about this work, we have published a report which we have included in the last slide on the deck, in this slide deck, and also there's some links to some of the assets that have been created as part of this work. There's also going to be some comms going live shortly, which will summarise all these different spotlights events that we've held as part of the accelerator, and also an overview of the roadshow we did, where we revisited communities to feedback what we'd learned. So thank you for listening.